Did you know only you can work to manage and improve your own health condition? That's right, no one else can. Before I get into it, this is day 6 of my 30-day challenge to get my diabetic condition and its low blood sugar under control. And today, it started actually kind of high after I ate something for breakfast. It went up all the way to 240, to that red dotted line. And then it went down over the day at work. And yes, this is my 3rd day in a row at work. So yay! It went all the way down to about 90 or 89 before coming back up again when I had a mint at work. So that's what's going on there. So why do I say it's only you and not your identical twin, not your wife, not your husband, not your children, not your mom, not your dad? No one else can improve and manage your own health conditions. It's because you make the decisions about your own body. You make those decisions. You know, I'll tell you, I was an alcoholic. After I found out, I only quit when I found out I had diabetes. And I knew the drinks I was taking, and you might as well just say you're taking it, had a lot of sugar in it. That's why it went up so high. But my wife couldn't get me to quit. No one could. No one could. Most people didn't know. But I did. And I made that decision. And that's why it worked. And that's why for the past 5 months, I have not drank any alcohol at all. But I have diabetes. It's not totally under control. It's not totally necessarily even managed yet. Although it is starting to do better. And I'm starting to now really see when to eat and what to eat using the device, the Libre 2 that I use to monitor the diabetes. So that's that. And I want to say that in my own family, I'm not the only one with a medical condition, and you, I'm sure, may not have diabetes. You may have some other medical condition, whatever that may be. I know people who have had cancer and got chemotherapy, and some have gotten better. Others have not. Some things are out of your control, but you know what's not out of your control? Trying your hardest to improve your condition. It may not work in the end, but it's the trying, it's the journey that matters. My own father lived to 58. Now I'm 52, so I'm only 6 years away now. And at my age, for the last 5-6 years of his life, his heart muscle was giving out. And, you know, I talk about when I worked at the company he worked at. Well, he would sometimes come to visit me in the warehouse. Now, he was an accountant. And I would sometimes see his lips look a little blue. And I don't think he really knew it. Like, he talked to me as if he didn't know that was going on, or at least didn't let on about it. But I noticed, and later on, he went to the hospital at Temple University in Philadelphia, and it was determined that he needed a heart transplant. Now, the doctors there make it seem to the families and to the patients that they do this stuff all the time, and people just get better. Now, to get a heart, somebody else has to pass away, and it's harvested and taken to somebody who needs it, and, they do surgery and they remove your heart, and they insert another heart. And hopefully it takes. Now, it didn't take with my dad. He was in that hospital for 2 months waiting for a heart. And when it finally came, he rejected it. His body rejected it. That was out of his control. His heart condition of just a heart muscle not beaten strong enough was totally out of his control. He used to jog and then he walked. You can do everything for your health, and sometimes just by genetics or what have you, the end result may not be what you want. But he didn't give up. He went, he got the surgery, and did his best to live. And so it is with all medical conditions. Now, not all are life and death. Yours may not be life or death. My wife, later on this week, is getting some surgery through her neck, but it's to help with the spine and the discs at the top of the back of her neck, actually. And it's to help with the nerves going through the spine, to help with movement, so her arm doesn't go numb or her legs don't give out, because my wife is in her 40s and she fell. And that started, and that was years ago. But it started a condition that the discs in the neck were off a little bit. And so that was contributing to nerves. I don't know if they're being pinched or not getting the right circulation to the rest of the body. And she fell a number of times. And she had one surgery on her back, on her lower back, and now they're doing it in her real upper now neck. So hopefully this will really, really help. They probably should have done this the first time. And you're probably going to say, well, Mike, you really want to get better because that's in 4 days or less, 3. And she's going to be out of commission for 1 or 2 weeks. And I'm really going to have to take care of the kids, but we're going to get some help. My mother-in-law is going to come over for a week. So you could say, well, Mike, you have to step up your game. And somebody actually said that to me. And I'm thinking, I don't even have my diabetes under control. My head feels funny. I have no game to step up. And that's when I started this 30-day challenge to manage and improve my condition of diabetes, where it's really under control and I'm just living normally, because lots of other people live normally with diabetes most of the time. But I hadn't. The idea is hopefully I'll feel good enough, and I hope you feel better in your health conditions. I'm trying to inspire that so that you manage your own health conditions and then improve upon that so that you're as normal as you can be, day by day. You know, and I'm going to do the best I can. There's a gentleman who's 81 years old on the internet. His channel is called Old Me Living Better, Old Mike, who I love. I love watching him. I mean, he has fantastic stage presence on camera, but he really cares about people, and you can tell. It comes through on the camera. Some people just really want to help other people. And he said, you have to have a mission if you're doing a YouTube channel. Well, this is my mission. My mission is to inspire you to manage your health conditions as best you can, and I do mean day by day, and then improve upon that. And also do it for myself. You know, I'll tell you, I started this channel, but I think it's the most important topic, health, and managing medical conditions and then improving upon it. And I did it because I wanted to hold myself accountable. I'm not like old Mike. I don't have 25,000 subscribers on this channel. I don't get 4,000 comments. I don't know if I've gotten one comment in all my videos, and this may be the 50th one. And I've had 3 viewers, or 3 views. Maybe it's one viewer who watched something 3 times in a row. That would count as 3 views. For any of these last 5 videos. But I'll tell you, if I'm helping myself by holding myself accountable to every day manage better my low diabetes and get it into range so I can go to work every day, which financially helps my family, I think we can work on that journey together. So it's helping me, and I want to help you by inspiring you to do the same. Don't just give up. Anybody can. It's actually easy to give up. Yeah, you may not like the consequences, which may be very, very, very bad. And I don't want to say what those are. But it takes commitment and that mission, and I'm using old Mike's word here, to get better, to manage the problem, and then improve your health problem so that it's not as much of a problem, or that you don't even have the problem anymore. My wife, the idea is that after she has the surgery, she's going to have to go to a physical therapist within a month and work really hard on twisting her neck back and forth with these implanted discs in there. And only she can do that. I can't force my wife to get her neck better. This is the idea that only you can improve your medical condition. Only my wife can improve hers by doing all that she can to make herself as mobile as possible for the rest of her life. And of course, it not only affects her, it affects our children. You could say it affects me, but I want to leave myself out of this. It affects everyone she cares about. But most of all, it affects her. And I want that to be the theme of this video. And I'm going to end with that. That only you can help you. Until next time, live your best life day by day.